Good morning, everyone.
Good morning.
Thank you, Benita. It's a real honor to be here and to have an opportunity to speak with such a diverse group of leaders in the interfaith community. So before I get started, I want to say thank you to the Reverend Chloe Breyer for organizing this important opportunity and for inviting me to participate as a representative of Children's Services. And I also would be remiss if I didn't acknowledge the Reverend Alfonso Wyatt, who has been a partner to many in the city and many in the faith community, but in particular to New York City Children's Services, as we have grappled with challenges over the years during my time as the commissioner and during previous administrations. I'm going to talk a little bit about the work of ACS, but those of you probably in this room are aware that we are an agency that deals with families in struggle, and we are a government agency that has rules to follow, and we are human beings that have laws and regulations to apply, and having a partner like Alfonso Wyatt to help us translate our very difficult work to people who are struggling to understand why we do what we do, and helping us in leadership positions translate why we're doing what we're doing to our staff who are struggling, has been, not just for me, but for prior commissioners, invaluable. And so having him here and having him as a mentor and role model for commissioners and for our young people and for our leadership has left really an indelible mark on our agency's evolution. So the faith community, as all of you know, has a significant role to play in our child welfare system. I, as you heard, spent a few years as a family court judge in Queens County. And for anybody who has spent any time in the great borough of Queens, you know that it is really the crossroads of the world. People come from all over and end up settling in Queens, and anybody who has tried to get an interpreter in Queens Family Court knows that the requests come in languages that as a judge I had never even heard of. And so you appreciate that cultures interpret government's role and interpret family and community in entirely different ways. And it makes you fully appreciate how important leadership in the faith community can be to an agency like Children's Services. We are approaching families in a Western model, and we have expectations of people to respond to us in a Western model, which is a very individualistic model of seeing the world. We expect parents to react a particular way when we think that their children are at risk. And that's hard enough when you're working with New York City people who were born and raised here. But when you add to that people who come from places that are thousands of miles away and just arrived months ago and have an entirely different concept of the individual in society and the role of community, it really makes an enormous difference to have faith leaders who many of our community members here in New York City turn to for guidance and most importantly turn to with trust. And so for Children's Services to be able to reach out to faith leaders to help us do our jobs to help children is an enormously important part of our work. And I am the first to admit that we haven't done enough of it. So you might have expected me to come here and talk about how important you are for us in terms of identifying foster and adoptive parents, but I will take a step way back and say how important you are to us in terms of actually reaching out to families to protect children in the first instance and to help reach families so that we can strengthen them and not remove their children in the first instance, but help them protect their kids in a way that our laws actually require. And so much of what I saw in Queens Family Court was really about that, was about finding people who, I think the term of art these days is cultural brokers. Am I using the right term? Where we find people in, very often, the faith communities who can help us connect with families so that they can help interpret in a way that makes sense and that our families can trust that we are not actually there to remove their children, but are there to try to help them understand that we have certain things we have to try to accomplish with respect to safety, and we have our job to do, but the goal in the first instance and our laws in the first instance are to help parents protect their children while the children remain at home. It sounds simple, it's a really tall order, and we would not be able to do it without the faith-based community, and I think Children's Services is committed to trying to figure out how to do that more and more, especially as New York City becomes more and more diverse and therefore more and more interesting. So, I wanted to tell you a little bit about ACS for those of you who don't know. We are an agency of about 6,300 New York City employees. Our budget is just under $3 billion. We are responsible for the city's early care and education system to the extent that we provide about $1 billion in subsidized child care and Head Start. And that is through both center-based care, so daycare centers, and through a voucher system. And about 65% of that $1 billion is spent on vouchers, and the rest is spent on center-based care. We are responsible more and more for the city's juvenile justice system, so we are responsible for detention services for children who are involved in juvenile delinquency cases in the family court, and we are also responsible for children who are 13, 14, and 15 and charged with the most serious offenses in the adult system. And as you probably are aware, New York State remains one of the 2 states where children are charged as adults as young as 13. And so my agency actually runs the 2 detention centers where those young people reside while their cases are adjudicated. We also run non-secure detention services, and through Governor Cuomo's close to home law, we now run non-secure placement services for children who are placed by the family court on delinquency cases. We have, since 2006, run alternative to placement programs for young people in delinquency cases who have been more and more kept at home on delinquency cases. And I'm proud to say that since 2006, New York City has seen a decline of children who are placed on delinquency cases from about 1,500 in 2005 to just over 400 where we think we'll see in 2013, which is an extraordinary drop. Those children obviously are now at home with their families in their communities with very, very high-end preventive services, and we have actually seen a reduction in rearrests, so a reduction in recidivism rates, which is positive for our kids. We are the agency most, I think, well-known for child protection. Our agency investigates about 55,000 reports of suspected child abuse or maltreatment a year, And we do that through our Division of Child Protection, 24 hours, 7 days a week. We find some evidence of abuse or maltreatment in somewhere around 40% of those cases, and then as the agency responsible for helping to reduce risk, we figure out what to do in that 40% of cases, and that can range from referring the family to a community-based organization. You are familiar with a lot of those, to a preventive agency, to bringing the family to court in order to get an order of protection in favor of a mother who may be at risk of domestic violence that we believe is directly harming a child, to asking the court to place a child in foster care. And so with that 40% of cases, we're trying to figure out what the right thing to do is. And as I said, in those cases, it is very helpful to have the faith-based community involved. And I guess the most obvious issue, I think, for us to be partnering more successfully with the faith-based community is around the idea of ensuring that when we have children from our diverse communities, it is more important that our children who come into care are in settings that are most comfortable for them. There is an enormous amount of talk these days about ensuring that we are reducing trauma for both parents and children in our juvenile justice and child welfare systems. And ACS has been successful in receiving federal grants with NYU and with Bellevue to actually bring trauma-informed treatments into detention and into child welfare practice. However, I would say that we have not yet reached the frontier of really trauma-informed removal practice. I don't think any jurisdiction in the country has really figured out how to best reduce trauma when you must remove a child. And clearly when you talk to children who have been removed, and I spent 14 years representing children, so I have had some experience talking to little kids who have been removed. Of course, 98% of them say they just want to go home, no matter what was going on in the home, because that is the natural response. But, you know, ACS has a requirement to go to a court to have the removal reviewed by a judge, and in many cases, judges order the removal. So you are left as a lawyer for a child explaining that that isn't going to happen, so we need to talk about you know, the alternatives. And having a home, as the woman who spoke earlier said, where the values that the child comes from are reinforced, is critical to a little kid. So if the child is from a sick background and is in a home where there's nothing that affirms that background, that is going to be further traumatizing for that child. So for ACS, it's critical that we work with the Interfaith Center and with communities of faith to encourage more and more foster families from varied communities to consider joining our provider agencies and becoming foster families for just this reason. We have recently ran a campaign across the city. We have a lot of materials. It was a successful campaign called Be the Reason, to try to encourage New Yorkers of varied communities to become foster parents. And our goal is obviously to have as many quality homes available as possible for our children. The other, I think, relevant issue to share with you is that we have undertaken a process with our provider community, our foster care agencies, to redesign the system by which we place children into the foster care system, so that we have worked hard to develop a matching system for children, so that there is a lot more effort taken to identify basic things that a child needs when they come into care. Things as simple as, is the child allergic to or afraid of particular animals, cats, dogs? Does the child identify as LGBTQ? Does the child have relatives that identify that way? And do we have affirming homes? Does the child have particular issues that most frequently are tied to placement stability? And we have worked really hard with researchers to develop an algorithm that actually predicts placement stability. And it's a scientific algorithm. And we have identified a technology that is not unlike what many of you probably use when you plan a trip to anywhere you may want to go on the weekend. So if you are planning to go somewhere for the weekend, my guess is that many of you go on your computer and hit www.expedia.com or .orbitz.com or .something.com, and a whole world of options come up, and you whittle your search down and you come up with, you can go into very clear specifics on exactly what you're looking for. Well, when we're looking for a foster home for a child in New York City, we actually just cold call our 32 agencies from an office down on 28th Street. So our new system will actually use the algorithm and a system like what I described, and it will whittle down our options based upon the child's needs and foster parent availability to about 7 homes in the city. And those 7 homes will be the 7 homes that are called. They'll be at various agencies, and we will start there instead of just cold calling. And we're probably about 2 months away from having this system. It's taken about 1 year and 3 months to get us to the point where we could have this system. But obviously the system depends on having homes that meet children's needs. And the only way that we can do that is by continuing to attract really quality homes for our kids. And as you saw in the video, we have extraordinary children. I'll close by saying that if you have any doubt about the extraordinary children that we have in our care, and I don't think you do, I guess it was in mid-August, Benita suggested that we have a breakfast for all of our young people who are either entering college or returning to college for their 2nd, 3rd, or 4th year, maybe even 5th. And so we did. And I came up from my office to the breakfast at like 9:20 or 9:30 and was overwhelmed to find that our 19th floor conference room was overflowing with young people. I think we have well over 200 children in foster care, young adults in foster care, who are attending college all over the United States, who came for their college breakfast with the commissioner. They all had name tags and contact information so that they could network amongst themselves. And it was proof that our kids are just like all other kids, with one additional feature, which is that they are truly more resilient than any other kids I know. And so we have created a network among our college kids so that they can rely on each other, and we have made them the promise that they can stay in care until they're 23, as long as they continue going to college, and we have made sure that when they have vacations, they'll have some place to stay here in the city. I say that because some people stigmatize our kids, and we need to rely on our faith-based community to eradicate that stigma and perpetuate the knowledge that these kids are extraordinary, which they are. So I'll stop there and ask you if you have any questions about New York City Children's Services.
You said only 2 states start at 13, but are we going to change that?
So there is an effort. So the other state is North Carolina. We are proudly in the company of North Carolina. And I wanted to be clear, I'm not sure North Carolina starts at 13. We have a juvenile offender law in New York that allows children as young as 13 to be prosecuted as adults for particular crimes. So they don't come to family court, they go to the adult system to be prosecuted. And the question that you asked, for those who didn't hear it, is, are we going to change that? I am aware that there are efforts underway. There have been bills that have been introduced in Albany, including one by our Chief Judge, Jonathan Littman. So there are certainly efforts underway, and there are people here in this room who are deeply involved in the effort to change that, who can speak to you and explain to you what those efforts have been. Yes, sir.
Say something what the recruitment process is like to find foster families. Mostly they come to you, or do you find
So first of all, if anybody wants to know about how you can find information about foster care, the easiest way is to go to www.nyc.gov or call 311, and they will get you in touch with Children's Services. Or when you go to www.nyc.gov, you'll come to our website, and there's a lot of information. But what happens is, once you come to us, we do an initial interview by phone. We have folks who work in a recruitment office, and then we refer families to one of our provider agencies, depending on where the interested foster family resides. We will also work with you depending on if you have a congregation or a community, a religious community or a faith-based community, in order to figure out how we can come out and talk to interested people. We'll try to be as helpful as possible to provide information. And that is through Benita's division. That's through the Division of Family Permanency, which is our foster care division. Is that right? Yes.
Is it true that people you can't ask about religion in the foster care family applying to be a foster care? And if that's true, can you explain why?
So there have been lawsuits about ensuring that your decisions about where children go are not colored by certain factors. And so how you make placement decisions is influenced by certain legal constrictions. And there's a lawsuit called Wilder, there was a lawsuit called Wilder, that constrained you in certain ways. So the answer to your question is, you have to be very cautious about how you make placement decisions, and so there are legalities involved that we're required to respect, but at the same time we are sensitive to a child's needs and to a family's preferences, and so we try very hard to be sensitive, but at the same time always respectful of the law. It's a complicated process, but there are laws that actually dictate what we can and cannot ask and what we can and cannot do in terms of placement decisions.
I just want to follow up on that, because I'm a little surprised to hear that. I mean, this is just from my own ignorance of the legal issues. I would have assumed that it would be like a no-brainer that if a child is being raised in a particular religious tradition, and if their birth family feels strongly that that's something that they want in the foster care placement, that it would be, maybe not a priority to override all others, especially safety and permanency, but it would be a big priority to find a placement that would support that child's religious and cultural background. But so just hearing you between the lines, like it sounds like you're not entirely able to do that legally, and I'm not quite sure why.
So I'm happy to say that that while we work hard to be respectful of what you just described, the way that the foster care system developed in New York City and in many other communities around the country actually was fraught with the systems grew up through religious organizations that ultimately may not have accomplished what you just described, and may have excluded certain children from certain placements. And so when that became apparent to certain folks, there were lawsuits to try to right what was perceived as a wrong. And so the outcome of those lawsuits was in fact trying to create a system of total fairness. And so we now have a system where we are not supposed to exclude children from going to certain homes based on the fact that they're not a particular religion. Because the system came up as only certain kids will go to certain homes, because the system was in fact initially just a religious-based system. Now, did you understand that? I was sort of speaking between the lines, but if you read The Lost Children of Wilder, which is a book that Nina Bernstein wrote about the history of New York City's foster care system, there is no reading between the lines. Nina Bernstein is an extraordinary writer. She still writes for the New York Times. She wrote a book called The Lost Children of Wilder. It is a phenomenal book about our system, and it will explain fully what I am saying between the lines, because it's a 400-page book. But it is really about what I'm saying, which is that the system was designed in a way where children were excluded from great homes because of their religion, and there was a lawsuit that corrected that. And we are working within the confines of that lawsuit. However, I want to say that our agency, like agencies across the country, are extremely respectful of a child's comfort level and will do everything we can to ensure that that is respected. And we do.
And of the birth parents' wishes for that place?
Absolutely. Absolutely.
Thank you.
Yes. Sure. Yes, ma'am.
Thank you.
I have two questions. I would say, you had mentioned something about non-secure, but I was thinking
Yes, so we run two kinds of non-secure. So this is in the juvenile justice area. Since the Department of Juvenile Justice, DJJ, and ACS were merged, we have run non-secure detention services. And so that's for young people who are detained on their juvenile delinquency cases in family court. And that we've had since, I think, 2010. We have since 2010. We have just since September of 2012 developed about 250 beds of capacity across New York City in 30 residences for non-secure placement, so that when a young person in family court gets placed on their delinquency case, instead of being placed upstate with the Office of Children and Family Services, they are placed here in the city with us in a relatively small residence that looks like they're all over the city. You wouldn't know that they're there. They're small brownstones, and they're here in the city, and that's non-secure placement.
how could the church as a whole help foster children without placement as a whole?
How could the church help foster children? In a lot of ways you could help foster children. In other words, so I didn't talk about this, but we have been in the process in the city of developing a new model of foster care called Child Success NYC. And child success is a result of years of dissatisfaction with our foster care system here in New York. To just get to the bottom line, we have 30 or so foster care agencies that have been struggling with inadequate funding to provide care to parents and kids. You know, and they've made that very clear. In other words, if you want really solid services for kids in foster care, and if you want to help their parents, you have to, you know, fund us better. So what we did with the state was we applied to the half of our money for foster care comes from the federal government through what's called Title 4E. It's not, that doesn't matter. And what we did starting in 2012 was we applied for flexibility in how we spend federal money, and we were able to lock in the federal government at $2012 for foster care for the next 5 years, knowing that our foster care numbers have been going down dramatically since 1990. So when I became commissioner in 2011, we had about 14,000 children in care. Right now we have under 12,000. So our numbers are going down because we're spending a lot more money on prevention to keep children at home. So what we are able to do is support our foster care agencies much more. We're paying a lot more per day to our foster care agencies. I say all of this because part of this new model includes trying to encourage our foster care agencies to work with resource organizations like the faith-based community to get our foster care agencies to get churches and others to be there for our young people and our parents who are going through foster care, to support them. You know, churches and mosques, synagogues, whatever, that are right near where our parents and our kids live, reaching out to them and letting them know that when the foster care ends and when the agency steps away, there needs to be a net to help the parent and the kid when they're going to have struggles, and inevitably they are going to have struggles. We know that, the data shows that. The families that have come in contact with foster care are going to continue to have struggles in life. But the struggles don't have to result in another hit with us. If there's a church where they can go and there will be people that they know there who can help them out, respite, whatever. So I would answer your question by saying that's how churches can help children and families, and by talking at forums like this and connecting you with our foster care community, that's how I think we make that connection. And I don't know what the next step is, but I can probably think about it, and others here can think about it, to make those connections more solid than they've been. Yes, sir.
Thank you for the comments. My name is Mohammed Hassan. Related to the juvenile justice and combination with the agency.
In reference to use of the combination of children's services with juvenile justice, were there any particular reasons other than administratively that took place? Because it seems that the separation was seemed to be pretty important at the time, because the juvenile justice approach to dealing with children seems maybe philosophically different from ACS, and if so, can you comment on that? And also with the whoever they are, what they're called now, officers or custodian people who have to oversee them, are there conflicts? How are they trained now to deal with the kinds of personalities that one might find in the juvenile justice situation?
Absolutely. So I would say that there is that it was done. So I'm always transparent. There were definitely economies involved in the decision because 2 agencies are more expensive than 1 agency. So you don't need 2 finance departments, and you don't need 2 administrative departments, et cetera, et cetera. But I firmly believe, and I was a judge at the time that it happened, so I had nothing to do with it. I firmly believe that it was done because our kids who were being cared for by the Department of Juvenile Justice were 13, 14, 15, and 16-year-olds. So they are not, they're kids. And so they should be under the jurisdiction of an organization that is designed like the Administration for Children's Services that has values associated with adolescent and child development. And so even though these young people have run afoul of the law, and we as an agency now have a public safety orientation that maybe we didn't have before, I think the goal was to associate 13, 14, 15, and 16-year-olds who have run afoul of the law with an agency that actually is about child and adolescent development and strengthening families, as opposed to a correctional type organization, which DJJ had traditionally been. And so that, I think, was the philosophical underpinning of the decision. However, I will acknowledge that it has been, to this day, it's been a couple of years, it's been 2 years and some months, it has been a challenge for our agency, especially for our juvenile counselors. And, Reverend Wyatt has been somewhat a part of trying to help us figure that out. Because for our juvenile counselors, they don't want to be social workers, they don't want to be prison guards. I think of that role as a hybrid, much like our child protective specialists, who are supposed to be social workers and investigators. Our juvenile counselors are supposed to be guidance counselors and guards. Those are really hard roles. They're these dual roles, but they're dealing with kids. And I think that's why ACS is such a hard agency, but it also makes sense that they should be with ACS. Are you approaching because you want to say something?
Oh, no, I was talking to my sister, I'm sorry.
I think it's hard. Yes, ma'am.
Good morning. Good morning. My name is Diane Mack. I'm with Catholic Guardian Services, a foster care agency. And I also supervise a team of folks who are responsible for recruiting and licensing foster and adoptive parents. So I'm delighted to see that I'm one of the only foster care agencies here today. So I'll continue my recruitment efforts. But I do want to say, I just have 2 comments. And one, I want to commend ACS on something that you haven't mentioned in terms of some of the changes that have happened in the last
I did not use my remarks, so I'm sure they're in here.
Okay, they probably are, and the rabbi that spoke earlier kind of mentioned it, and I wanted to talk about the community partnerships that are currently in place in 11 communities, in which each of those partnerships generally have a conferencing committee or work group that work with families. They have individuals from the community to sit in the conferences to be a support to birth parents. So when we have questions about religion or other factors that go into deciding placement, this is an opportunity for birth parents to be educated about the changes in ACS, what supports are there, and who they can bring to the table. And so if families are able to identify folks from their religion or who are of their belief, who would be willing to step forward and assist the family through this crisis by helping to care for the children if necessary, or helping to support the family if the children are not removed. This is a critical place that the faith communities could help for our families, whether they're in foster care or to prevent the children from going into foster care. So that's one way that you all as leaders and in your churches and in your faith communities can begin to help to find out where those partnerships are. And if they don't exist, because we have 59 communities, then how else can you be a part of that opportunity?
Can I just say that we have Assistant Commissioner Dale Joseph here and Nigel Hawthorne. Did I get that right? Nathaniel Hawthorne. Did I get that right? Nigel Nathaniel. Why I'm saying Hawthorne, I don't know. Nigel Nathaniel and Dale Joseph, can you stand up? So these are folks one is an assistant commissioner, one is a director, am I going to get that right? From our community partnerships office. Nigel Nathaniel Hawthorne, not Hawthorne.
They'll be talking more about that in the next segment.
So you'll hear more about this, but clearly that's what you're talking about.
Yes,
Okay.
and so that would be great, because that's a vehicle in a way that faith communities can help and be present from the beginning. And the second is also kind of a response to how can churches help. In my role, I actively work with churches to develop customized foster care ministries if they are interested in doing that. Because in the communities, wherever they are, sometimes there are over 200 churches, and the size of the church could range from 5 members to 500 or 5,000 members. And what does that look like? And so if you are interested, whether it's in the communities that I am assigned to, or other communities, because there are foster care agencies assigned to all of the communities, is to begin to have a conversation with your congregation and with your pastor about what is it that we can do. Not everyone will be able to be a foster parent, but in addition to providing food and Christmas gifts and book bags at school, maybe your community can also offer a support group or help provide childcare or help provide respite, or come with a parent to a meeting, help them understand what is being communicated to them, and most importantly, find alternative ways of discipline. Because I encounter so many people who say, oh, I can't hit the child, I can't be a foster parent. And so we have to re-educate ourselves and re-educate the ways in which we parent and how we help people parent. And those are ways that the churches can help.
Thank you, baby.
All right.
Thank you.
Commissioner, this young lady was a 14-year-old in my youth program, and I see she is still at it. So, but even though I love her, I came and squeezed her.
And so I'm just going to hit it and quit it. Is that all right? I'm from the Department for the Aging, and I represent the Grandparent Resource Center.
Yes.
I'm the deputy, and my director's here. And that's right, clap, that's right. And basically what I wanted to say is, of course, when our grandparents call us and contact us, and the child is now placed in their care, there's a lot of things that go through their minds. A lot of them, don't know how to navigate within the systems, just an array of things. And I wanted to know what, if anything, is on the rise in terms of ACS to kind of help them transition into those roles. I know what we do at the Grandparent Resource Center in terms of trying to help them move along, support groups, one of the things she mentioned, and just a variety of other things. But what, in effect, do you have, or what's coming up on the rise that's going to help integrate our grandparents with the children that are now in their care? Because a lot of them, of course, it's the new millennium and they're decades apart.
Yeah.
Could you share with us about that?
So so there are generally two categories of grandparents that are caring for their grandchildren. One category are grandparents who are foster parents, and they have the support of a foster care agency, and they're probably not the grandparents you're talking about. You're probably talking about grandparents who have children that the court paroles to them. So they're probably the grandparents who don't have the support of a foster care agency, who just got the kids while the parents have a case, or maybe when the parents don't even have a case and we got involved and we said, oh, it would be great if the maternal grandmother filed a custody petition. Yeah, I know about those because I was one of those judges that did that. So that's called, an informal family arrangement that turns a little more formal.
Right.
Because that's, that's a resolution where the parent doesn't have to have a case with us, which is really good, because who wants a case with us? And grandma steps in. So, these are cases where ACS we don't play a formal role, although we could be, and we should be, providing preventive services, and that's probably where there could be some work done between the Division of Family Support at Children's Services and your office. And we do actually have preventive capacity. So it's an area where I wouldn't say it's on the rise other than you're raising it, so it should be on the rise. And something that Dale, maybe we could talk to Jacqueline about as a result of this meeting, figuring out how to partner with you at your office to figure out where the link between our preventive agencies and your grandparents where the link up could be made, because that's the right way to do it. It's not to have those children come into foster care, because that is not helpful.
Thank you.
Good morning, Commissioner. I just want to congratulate you on the appointment. I have a question, but you don't have enough time to answer the question here. But I'm hoping that you'll have some opportunity to talk afterwards at some point with this type about the issue. Essentially, as you describe the issue of foster care, the best way to describe it is there are some issues that are related to the comporting as a jurist between public policy, public health and statutory considerations in New York State, particularly around New York State Social Service Law 383 and invisibility of certain children in the system.
Say that one more time.
Invisibility, cultural invisibility of some children. Because you have a mechanism set up to identify children based upon certain particulars. And some kids have not been identified. So we need to have that kind of conversation after. Nigel is familiar with the issue, so I'm just bringing that to your attention. At some point we can have the dialogue at some point in the process. Because there are very lengthy issues that involve looking at the ACE studies that came out of the West Coast trauma-informed study, and a lot of issues that are affecting children in terms of attachment issues that we need to address. So at some point I'm hoping that you're open for the dialogue.
I certainly am.
Excuse me, Commissioner. My name is Theo Harris, and I work for the Interfaith Center as their new outreach coordinator for reentry. And one of the areas that you mentioned was juvenile delinquency.
Yes.
And as a recovering juvenile delinquent, I want to just find out how juvenile delinquency is defined nowadays, and how hard is it to place people who have that background, who have that history, and what are you looking for in placing them in terms of the foster parents themselves?
So juvenile delinquency is defined right now as a person 15 and under who has been found to have committed a certain class of crimes, and it's most crimes under the penal law, excluding very few, who's 15 and under, and once they have been found to have committed that act, they have also been found to require supervision, treatment, and or confinement. So those two things. They committed a crime that if they were an adult would be a crime, and they require supervision, treatment, and or confinement. And that's what juvenile delinquency is, and that's all in family court. And that's not a conviction. A juvenile delinquent is not convicted of a crime. That's the difference between being a juvenile delinquent and being a criminal. So you're not a criminal. There is no conviction on your record as a JD. And so we actually, you can actually have a kid who's a JD put in a foster home, and that sometimes happens. In the majority of cases, young people who have a delinquency finding are at home with their family.
Thank you, sir.
Commissioner Richter, I don't have a question. I just wanted to say, we have been working for the last 5 years on the case environment program.
Yes.
Faith-based initiatives in churches, seminaries. What I wanted to just say to you is that you have an extraordinary staff. persons from ACS, a number of whom are here today.
Thank you. If everyone didn't hear that, we were told that we have an extraordinary staff at Children's Services.
Thank you, Reverend Mason. And thank you, Commissioner. And I'm going to ask Sarah to just come and keep on moving. Can we give a hand to our commissioner?